Pelvic pain after endometriosis surgery can feel like the ultimate betrayal. You did the research, you found the specialist, you went through surgery, maybe even more than once. So when the pain comes back or never fully leaves, the immediate assumption is the endometriosis must be back. But what if that's not always the case? Today, we're talking about something that's often overlooked in the endometriosis world: vascular compressions, specifically May-Thurner syndrome, and how it can mimic, contribute to, or even drive persistent pelvic pain. For many people living with endometriosis, the instinct when symptoms return is to rush towards another surgery. But what if the next step isn't another operating room, but a deeper investigation into other pain generators? Because not all pelvic pain is endometriosis. And if we want better outcomes for this community, we have to start asking better questions. So stick around. Welcome to Endo Battery, where I share my journey with endometriosis and chronic illness while learning and growing along the way. This podcast is not a substitute for medical advice, but a supportive space to provide community and valuable information so you never have to face this journey alone. We embrace a range of perspectives that may not always align with our own, believing that open dialogue helps us grow and gain new tools. Join me as I share stories of strength, resilience, and hope, from personal experiences to expert insights. I'm your host, Alana, and this is Endo Battery, charging our lives when endometriosis drains us. Welcome back to Endo Battery. Grab your cup of coffee or your cup of tea and join me at the table. Today, my guest is someone who wears a lot of hats, most of which she didn't exactly apply for. Chelsea Taylor is an endo warrior who, like so many of us in this community, has spent years navigating the confusing maze of chronic pelvic pain, surgeries, unanswered questions, and the frustrating reality of symptoms that don't always fit neatly into one diagnosis. At some point along the way, Chelsea did what a lot of us end up doing. She became her own researcher, investigator, and professional "this doesn't feel right" question asker. She's also one of my closest friends, a fellow board member in our nonprofit, and someone who can send you a research paper, a meme, and a voice note roasting the healthcare system all within 5 minutes. Chelsea's journey has included looking beyond endometriosis when symptoms persist, which led her down the rabbit hole of learning about things like vascular compressions and May-Thurner syndrome, something many patients are never even told to consider. And while she is currently in nursing school, which feels like a very logical next step for someone who's basically been forced to learn half of medicine just trying to survive their own body, today she's here as a patient sharing her experience and perspective. She's also one of the smartest, funniest people I know, which means this conversation is probably going to include equal parts learning, validation, and likely a little sarcasm. So please help me in welcoming Chelsea Taylor to the table. Thank you, Chelsea, for coming back to the table. It's been such a long time since you've been here, and I don't appreciate that.
I
Just
know.
putting that out there.
We've been trying to make this happen for like so long, and it just has not come together. But here we are.
Here we are. We finally made it happen.
Yeah. Happy to be here. Thank you for having me back.
You know that I would have you all the time if I could.
I know.
But apparently you have to go to nursing school. It's
Yeah,
weird.
it is slightly ruining my life, if we're being honest. But it is fun. So
It is fun.
Yeah.
For those that don't know who Chelsea is like one of my best friends in this whole world who I've met because of this disease. And so I met her with the nonprofit that we run together. And then it just kind of like trickled into this amazing friendship, sisterhood, like work-wife relationship where debauchery, a lot of debauchery. We get in a lot of trouble together.
Yeah.
We're not known for being filtered
or quiet.
Yeah. And we're known to corrupt people for karaoke.
Yes. Oh, yeah.
At any point in time.
And a little twerking.
You never know what's going to come from us.
You never know what's going to happen.
But before we get started, one of the things that we talk about is like our drink orders. And I can just go ahead and tell everyone what our drink order is.
You guys probably know already.
Yeah, we really need to be sponsored. Just Peachy from Ziggy's.
The best drink in the world. I blame Alana. Like, I would have so much more money in life if it wasn't for Alana introducing me to these drinks, because I don't know, it's been like 3 years,
Yeah.
4 years
Yeah.
since you introduced me to it, and I can't even fathom how much money I have spent on just peaches in my life, and I have corrupted a bunch of other people with it too, so all of my other friends love the just peaches.
You're
And yeah,
welcome.
they're delicious. So,
You're welcome.
Ziggy's,
Ziggy's.
still waiting.
Still waiting for that
Yeah.
sponsorship to come through. That's fine.
Yeah, so
Okay, so now that we have, and it is an energy drink, which we don't need and yet we don't need. Like, it's
Right.
kind of that, like
good energy. It just kind of
No.
makes me a little more squirrely than normal, but that's fine.
it's fine,
It makes it fun.
but it's tasty.
Yeah, it is fun. So, and it's delicious.
And it is delicious. So, for those that haven't listened to Chelsea's episode way back when this podcast first started, we are going to rehash it just a little bit because I feel like not only has your story shifted and changed a lot, but it's also evolved in the way that we recognize our story as pieces of our story coming full circle. I feel like the more we've learned, the more we realize that we didn't know a whole lot going through this process. And even 2 or 3 years ago, we didn't really know that much. Like, we knew very little compared to what we know now.
We know a lot more. So that's absolutely, absolutely true. So yeah, I have a very typical endometriosis story. So it started with me as a teenager. I was symptomatic. I had really painful periods. I had cramps. I had leg pain. And I spent years and years and years in and out of doctor's offices, which is a very familiar component of most people's endometriosis stories. At one point, I think by the end of my journey, I think I had seen over 30 doctors for my different symptoms that I was experiencing. And I would go through this cycle where I'd go to the OBGYN and talk to the OBGYN about things. And they would say, oh, this is just normal, but your GI symptoms are weird. So they'd send me to GI and I'd go to GI and they'd be like, oh, no. They would think it was just IBS, and I would get sent back to my PCP, and then we'd look at my urinary symptoms, and I'd go to urology, and they would say I had painful bladder syndrome, and it just was this like constant cycle of these like, I want to say like pseudo diagnoses, not to say that they aren't, but it's just it just didn't feel like they were being investigated. It was just kind of one of those like, oh, you have these symptoms, IBS. You have these symptoms, it's got to be painful bladders, or interstitial cystitis is also what it was referred to. And it was like, so what do I do about these? And they really didn't give me any good options for anything. And it was technically my 7th OBGYN that was like, hey, I think you have endometriosis. Like, all of this makes perfect sense, but she was not surgically skilled enough to handle the level of disease that I had. And so I ended up seeking care through a specialist that I found through Nancy's Nook on Facebook, and went and had my endosurgery in October of 2020. And it was awesome. As crazy as that sounds, I have never, ever, like, truly in my life, like, I think about the really important moments that were in my life. And it was like, meeting my husband, having my kids, and the day I got my endometriosis diagnosis, because it was such a powerful moment in my life after over 20 years of being gaslit and being told that it was in my head, being told that I needed a psychiatrist, that I was anxious or depressed, and that's why I felt like I was dying every single month. And so it was just such a profound moment in my life. I remember sending my mom a text and was like, I am not crazy. They found endometriosis like everywhere. And so I had excision surgery. And at the time, I also was done having children, and we suspected adenomyosis. And I also had fibroids. And so I had a hysterectomy at the time. I lost one ovary during that surgery due to a large endometrioma. We managed to save my other one, which was great news. And at the time, I was like so stoked to save my ovary because I was like, I won't go into menopause, but that still happened. So, which we'll talk about. But that was one of those things I learned years down the road that can happen. So I felt pretty good post-surgery. I had some complications around the 14-week mark that I ended up being hospitalized again, and I ended up with an infection, and it was a rough recovery for me. I also do have EDS, and so that definitely contributed to my compromised healing, and it just took a lot longer for me to kind of get back to normal after my surgery than what it would take a typical patient, I think. So went through all that, made it through my complications. It took about another 6 months after that, like I would say midsummer of 2021, where I started being like, okay, like this is kind of my new
Yeah.
baseline. Like I feel like I've healed from the surgeries. I ended up having a second emergency surgery to fix a few things. No fault of the doctor or anything like that, just my bad connective tissue. And I was still kind of having some issues. And it like to the point where when I went in for something and I was like, can you see if they actually took out my uterus? Because like I still feel like I have a uterus. Like I still feel like I'm having these like menstrual cramp type feelings, like that kind of lower pelvic, like heaviness and just kind of achy, and it was uncomfortable. And it was nothing compared to what I dealt with the endometriosis. Like that was absolutely like debilitating. Could not get out of bed, could not go to work, could not function. And this was tolerable, but it was still uncomfortable. And I was kind of upset, thinking like, oh, my surgeon probably missed something. And, starting to second guess if I had a quality surgery. And I just went down this rabbit hole of like the spiral of sadness because I thought for sure like I was destined to be that person that had to have like surgery after surgery and I was just never going to be completely well. And I started really like paying attention to my symptoms and tracking things. And I was really, this is one of those things like I was lucky in a sense because my mom was diagnosed with a condition called May-Thurner syndrome when I was a teenager. And with May-Thurner syndrome, it is an iliac vein compression. So your iliac vein and arteries run down kind of in your pelvis. Your artery comes off of the aorta and splits into two. And then the iliac vein comes off the vena cava and splits into two. And what happens is the artery sits over that vein and compresses that vein, usually the left iliac vein. And my mom had that. And so she had had multiple blood clots from it and had really struggled with a lot of complications and just serious pain and had gone through a lot with this. And so it was something I was kind of familiar with. And I started really thinking about it and paying attention to how my legs felt. And I realized that while the endometriosis surgery fixed a lot of my musculoskeletal issues that I had, my back pain had improved with my endo surgery. I mean, it still didn't feel great, but it was so hard because I was really truly living my life like on a daily pain scale of like a 7 to an 8. I mean, honestly, every single day I was having a hard time walking. I was having a hard time moving around, getting in and out of bed. I couldn't work because I was so ill. So any improvement from that, was really nice. And it was like easy to just be like, okay, well, like this is better, but I still didn't feel great. And I've started paying attention to a lot more of those symptoms and just really kind of tracking how I was feeling and tracking what was going on in my body. And I started to realize that I was still having some issues with my legs and they just felt really heavy and my pelvis felt really heavy. And it felt like, it's often described as like a hot bowling ball is like sitting in your pelvis.
Yeah.
And I kind of felt that way. And I was thinking about it. And that's how my mom described a lot of her pain that she had with her May-Thurner syndrome. And so I talked to her a little bit about it. And, I was like, I'm really thinking that this is something that I should consider looking into. And so I went to my PCP and like in true, like endo gaslit, like trauma fashion, had a telehealth appointment with her. And I literally had sticky notes all the way around my screen because I was like, I need to get this referral and I don't think she's going to give it to me. Like, I'm so used to just being told, no, like, you're not going to do this. You're not going to get this. This isn't you. This is in your head. You had surgery. You should be fine. You had a hysterectomy. You should be fine. And so, I went in like overly prepared, like with all these sticky notes, like all my symptoms, everything that I was dealing with and trying to get this referral. And thankfully she was really receptive to it, which was very, very nice surprise considering what I had been through before. So she gave me the referral. I went to a doctor down in Denver and was scheduled for what's called a venogram, where they basically go in and they make like a little, for mine, they can go in different places, but for this one, they went in and made a little incision in my neck and they follow your veins down and they just do different like testing through those veins. They do like ultrasound, like endovascular, so inside the vein, ultrasound, and they kind of can see like how things are flowing, if there's compressions in there. what your blood velocities are, so how quickly your blood is flowing, if it's flowing in the right direction. So I had that done, and they were like, "Oh yeah, you have May-Thurner syndrome. You also have something called nutcracker syndrome, which is a condition where your renal vein, usually the left side, is trapped and kind of squeezed by between your aorta and your superior mesenteric artery, which is that branch that comes off of the aorta and kind of runs down into your abdomen. And so it was just kind of squeezed like a nutcracker, which is why they call it that. But it's a left renal vein entrapment is the anatomical way, I guess, to describe it. And so I had that, and that made a lot of sense because I felt like I had a kidney infection, like, all the
Yeah.
time. Like, I would get this back pain, that flank, uncomfortable, like, burning sensation in my back, especially if I'd been on my feet for a long time. So if I was active at all within, cleaning my house within about an hour of, like, doing stuff, cleaning, being on my feet, walking, I would get this, like, searing back pain, like someone was, like, stabbing me with, like, a hot poker. And so things started kind of coming together, and I was like, okay, some of this actually is making sense. I was having some bladder stuff, not terrible, nothing compared, to what I dealt with the endo, but was still having some weird, like, bladder sensitivity issues. And so I ended up pursuing treatment through this facility in Denver, and I had a stent placed in my left iliac vein. So, and after that, I felt pretty good for a while. I was doing really well. It really did change the quality of my life. I was able to go back to school. I was really doing the things that I wanted to do. We went to Disneyland like shortly after that, which
Which is
I
a
had like
miracle.
dreaded going, or Disney World. I went to Disney World with the kids, and it was like, I was dreading going because I was like,
Yeah.
there is no way that I'm going to be able to walk. Like, I'm going to be in the hotel the whole time while everybody else is out having fun. And I made it the whole trip, 4 solid days walking through Disney, like 20,000 steps a day. And I felt great.
Probably other than being overstimulated.
Yeah, like, it was a lot.
It was a lot.
Thankfully, my kids are older, and so when I did get overstimulated, I'm like, "You guys go do what you wanna do, and I'm gonna go sit and have a margarita at this lovely
Yeah,
restaurant."
and like hug myself.
Yeah.
Yeah.
Yeah, exactly, and I
Yeah.
let them stay at the park late with my oldest daughter, and so, yeah, they had a great time, and I went to bed a little bit early a couple nights,
Yeah.
but I made it. I made the entire trip. I really didn't feel terrible. Standing in line was a little tough on me. I still find that standing in one place, like, being stagnant like that, is hard. I can walk a million steps, but don't make me stand for more than about 5 minutes in one spot. So yeah, it helped a ton. It made a really big difference in how I felt. And then I just started kind of feeling bad again. And some of those symptoms started creeping back in. My left leg was really heavy again. I was really lucky because I never had any blood clots from this. Blood clots tend to be very common, and a lot of times how people discover that they have venous compressions like this, like May-Thurner. So I was very lucky because I did not have any issues like that, but I could just feel it kind of creeping back in. So I actually made another appointment with a different doctor, an interventional radiologist out of Denver. Her name is Dr. Brooke Spencer, and went and saw her. And she was highly suspicious that my stent was not in the right place. So we ordered some testing. I did like a pelvic MRI. We did a pelvic MRV, which is another type of venogram. And my stent wasn't in the right place. So we don't think it necessarily migrated because it was actually sitting lower. And typically, if a stent migrates, I think it usually moves in the direction of the blood flow, which it would maybe
been
move
up.
upwards instead. But I think it was just my stretchy, bad connective tissue that, like, and the weight of it all just kind of pulled it to where it was no longer where that, like, bifurcation is in those veins. And so April of 2024, I went back in for another procedure and I had a second stent placed. And life-changing, so much better. Everything's been great. It's been almost 2 years now. I still go in regularly for ultrasounds. I actually had one just a couple weeks ago down there, and everything looks really good. It's in the right place. It's doing its job. So I have, probably I'd say about 8 inches of metal running inside of me between my belly button and my groin on my left side. But I don't notice it, can't feel it. And it has really given my quality of life back. I am in nursing school, and I can't even imagine trying to go through what I am doing right now. There is zero chance I could make it through some of these clinical shifts that we're doing if I had not had these treatments and found the help that I did for what I'm doing, what I needed done.
Well, and it's interesting because, like, I remember when we first met, you'd already had your stent, I think, at this point when we first met.
Probably, yeah. Yeah,
I
I think
think,
I had just gotten it done
yeah,
because
I think you did.
it was right around when we started our nonprofit,
Yeah,
before we decided to make it a nonprofit.
right.
So when we
So I'm
meet in
pretty
the
sure,
dealership conference room.
yeah, which was amazing. Um, but I do think like during that time, I remember you really struggling with food a lot more. Like it was always like you were losing weight like crazy because you
Yeah.
couldn't keep food down. You felt awful pretty much all the time. And then as a couple of years went on before your second stint was placed, when we were in Florida, and I'm going to insert the picture because I actually have a picture of this. When we were at the summit, you were standing in the back of the room with one leg up elevated and
Yeah.
the other leg like just standing there. And I
Yeah.
actually have a picture of it. And it's because it was like, looking back, it looks really awkward, but I knew exactly what you were
Right.
doing.
Yeah. It was funny too because I remember Sally came up to me and she like looked at me and she looks at my leg and she looks at me and she goes, "Do you have May-Thurner syndrome?" And I was like, "I do, yes," because
Mhm.
I would always have my leg up
Yeah.
somewhere because if I didn't, all that blood just sitting and pooling in my leg, it would hurt. It
Yeah.
was uncomfortable, and so yeah, I was like notorious for having my feet up on the back of somebody's chair,
Mhm.
or like I think in the picture you're talking about, it's like literally sitting on a countertop.
Yes.
Yeah.
You know,
And I know which one you're talking about. Yeah, and I always had it up. Or I would lay on the floor and put my feet up on chairs and like I didn't care where I was. Because it was just like I have to do this or else I feel like my leg's gonna explode. And so yeah, it was really uncomfortable. And I had a lot of food issues, and it kind of goes with another compression issue. So when I had my complications, like between my endometriosis surgery and my complications from that, with my endo, I had really bad nausea. And so
Mhm.
I was already kind of having a hard time like eating and keeping weight on. And then with the surgery, I really just couldn't take very good care of myself afterwards. I was still struggling getting enough protein in and just getting enough calories in general. And then after all the complications and the hospitalization, like I just did not feel well and I lost so much weight. And so I ended up developing another type of compression. And I was very lucky because it was a transient kind of thing for me. I was able to fix it by gaining weight. But I had something called superior mesenteric artery syndrome, where again, it kind of runs through that same path that the renal vein, your kidney vein, runs through. But you have a portion of your small intestine that also runs between your aorta and your superior mesenteric artery, and it would pinch that off, and it made eating like very painful.
Yeah.
I would just get so nauseous. Anything solid food wise, like I could take like one or two bites before I actually felt like I was going to throw up because it made me just so ill to eat anything. So I had consulted with a surgeon out of Denver and worked with him a little bit. And I just really was not interested in having another procedure and another surgery and have them go in and try to fix that surgically. Sometimes it works really well for people, but I really wanted to take a more conservative approach. And so he had me on a liquid diet I was on it for 7 months, where I literally drank every single meal pretty much for
Yep.
7 months straight. And in Disneyland, actually, I drank most of my meals. I brought my little like mini blender. And so I bought those Ensure or Boost drinks and I mixed them together, with some ice and throw a little half and half in there. And I mean, when at my worst, I was down to 92 pounds,
Mhm.
which I'm 5'5". So I was like, me now is about 50 pounds less than what I weigh now. And
Yeah.
so it was a significant amount of weight that I had lost. You could see all of my ribs in my chest, like where they attached to my sternum. And I looked ill. And so that one was thankfully something that I was able to resolve on my own, for the
Right.
most part. And once I gained the weight back, there's a little fat pad that sits kind of in that area. And there are some patients who are lucky and they can gain weight. And when that fat pad increases, it buffers that space enough to give it room so things don't get so smashed down. And I was one of those patients. So I just have to be really cautious, make sure my weight stays within a certain range. If it doesn't, I start getting symptomatic again. But yeah, it was a struggle there. You have traveled with me a few times where I was just
Yep.
like, I can't eat this. Like, I can't
Yep.
eat anything today. Like, I'm going to drink my calories and
Yep.
hope that I can function well enough to get through this, because venous compression stuff can really wreak havoc on your life,
Mhm.
and it's really hard to kind of figure out because it's so vague.
Yeah.
there's so much overlap in the symptoms. I mean, truly, like my endometriosis symptoms and my pelvic vein disease issues and my May-Thurner stuff and nutcracker stuff, like they really felt very similar.
Mm.
I mean, very, very, very similar. Like to the point again where, I was like, are you sure that my uterus is gone? Because I feel like it's still there. So, and it's just a lot of that, those veins get full of blood. They put pressure on the pelvic nerves. They put pressure on the other structures in there. They get inflamed. Everything kind of gets irritated. And it really can kind of mimic a lot of those things. So I was happy with the route that I took, where I started with the endometriosis excision. Though it is invasive, like it's not something like with a stent, because stents are typically seen as permanent.
Right.
So there are times where they will try to go in and remove them, but they're not. It's a really dangerous surgery because your iliac vein is a giant vein
Right.
and a very important vein, and it's very hard for them to go in and take that out once it's actually like set in that vein. And so I'm glad that I did the less invasive, like less permanent, I guess, solution first, pursued all that, got that done, and then went on with the stenting because, I'll have metal in my body for the rest of my life. But my mom's had hers for almost 30 years now, and she's doing great. So she's got a few stacked up in her too. And she just has, we have matching interior hardware. So,
And you don't set up the metal detectors in the airport, so you're good.
right. You know what's funny though is when I was super, super lean, like when I had lost all that weight, it did set it off one time. And like they sat there and like I was stuck in security for a few minutes because it just kept, because I was skin and bones. So, and it was sitting like, and
Right on
that's
the
the only time it
surface.
ever happened, but now there's
Yeah.
enough there to cover it up. So but yeah, it was weird. And it's not supposed to set them off. They tell you
Right.
it's not, but they sat there and scanned over my like lower, left quadrant, like over and over. And I was like, like there is nothing here. Like,
Promise you.
like I'm in leggings, of course, because I
Yeah,
live
that's
in
what all you wear.
leggings.
Yeah.
But yeah, like I'm not hiding anything.
Well, and it's like,
So
this, like you have metal in your body, but they don't know that, like going
right,
through it.
right, yeah,
But I think the thing what's interesting about this is I had never heard of this until I met you. And when you started bringing up all the symptoms that were so similar to endometriosis, I think a lot of people have like these reoccurring surgeries thinking like my endometriosis is still back or it's come back or they didn't take care of it all or whatever the case is. And so you're just chasing surgery after surgery after surgery. And the problem with that is that the more that you do that, the more scar tissue you have.
mm-hmm.
And then it does, I mean, could they always find endometriosis? Probably. Like, maybe, I don't know. And
Right.
then some people, they get the pathology back and it's negative. And so there's that crushing feeling of like, what is going on with me? And we're realizing that there is a lot of like linking between those with endometriosis and those with vascular issues. And I don't know why that is. I don't think they really know why. I think they're starting to look into why and investigate it more. But it just feels like for those that are maybe going through figuring out symptoms, like this may be an avenue that you want to consider. And this is not a surgery or an avenue that you want just anyone for. You need a specialist who really gets this and understands it to follow that journey.
Right. Yeah. And I feel like it's one of those things that's really easy once you have an endometriosis diagnosis to just assume everything's endo. It's endo, it's always endo
Right.
because, there is no cure. We manage it surgically as well as we can and hope that we, can trust in our surgeons that they did a good job and they cleared out what they saw. And, but there is always that chance of recurrence.
Right.
And so I think you get trapped in that like cyclical mind, like thought pattern where it's like, it's endo. It's always going to be endo. I'm always going to have this. And I think we fail to consider that there are a lot of pelvic pain generators that could be a possibility, between the vascular stuff, endometriosis, pelvic floor dysfunction. There's just a lot going on there. You can end up with nerve entrapments. You can end up with like central sensitization issues. There's so much crammed in this tiny little space.
Yeah.
And I think it's when you see it on like an anatomical model or like in a textbook and you see how, all the organs look and stuff. It's nice and they're all spaced out and, you can see everything in there is smashed. Like it is like smushed together, like they're all laying on top of each other.
Yep.
And so there's a lot that can go wrong. And, it's not just the ovaries and the uterus that are there. You have your, intestines, you have your sigmoid colon, you have your rectum, you have all of these pelvic nerves. It's just, there's so much at play. And I think it's really important that we just take a step back, especially post-surgery. If you have surgery with somebody who is considered a specialist and you, I'm hoping, did your homework before you had surgery,
Yep.
you know that they're doing a lot of these surgeries, you know that they are competent in what they're doing. They're not a standard OBGYN that's doing 3 or 4 endosurgeries a year. If you feel confident in your surgeon's abilities and you know that they've had good outcomes typically overall, I think it is worth investigating other pelvic pain generators. And it's really interesting because, with our small nonprofit group, what are there now? 7 or 8 of us that have May-Thurner diagnosis,
That we know
I think.
of.
Like, those are just people where, like, we've talked about things, we've talked about the symptoms. Some of them attended the endometriosis summit where Brooke Spencer did a talk about these things and pursued care after that. And I need like a referral card for MIPS at this point.
Yeah.
like I've sent you 10 patients. Can I get a free ultrasound? I don't know, something like that.
So many patients.
Right. Yeah. But so many of them ended up having this and a lot of them pursued treatment and were stented. Some of them are waiting. So you can take a more conservative approach and just watch it and wait it and see what happens. But for me, it really made all the difference in the world. It's allowed me to have my life back. It's allowed me to pursue the things that I want to pursue and do it without being miserable. I could have probably suffered through school. I could have suffered through all of this, but like I'm enjoying it because I am not dreading going and standing in the hospital for 10 to 12 hours a day. I can do that. And I look forward to my shifts there and I look forward to walking around and interacting with people and doing stuff. And I'm not like dragging my leg behind me and like,
which did happen so many times.
Yeah. And like patching lidocaine patches, where I have like 8 different lidocaine patches and a heat belt on and like all these other things. Like I can go to work or, go to school with like my like bag that has like a normal size, like travel thing of Advil. And like, that's it. That's all I really need to bring with me instead of like an entire medical supply kit where it's like, I don't know what's going to happen. I don't know how I'm going to feel today. I don't know if I'm going to need this or this or this. So yeah, it's been an adventure, and it took a few years. And that's the other thing is you really have to be patient. Sometimes it takes time to kind of figure out what's working and what's not working. It takes time to find the right doctors. It takes time to find the right treatments for you. And, start to finish my endo, surgery, really like I started pursuing surgery June of 2020. And here we are, but yeah, it takes time. It took me a few years to really get to a place. And even there, I recently, on Christmas Eve this year, I went and had what's called a greater saphenous vein ablation, where you have these like surface level large veins in your legs. And I still had a little bit, like my legs, they didn't really hurt or anything. They just get kind of tired. And it wasn't anything debilitating, but I had a pretty significant amount of reflux in my legs, probably from years of them just being like blood pooling in them and them not being able to function properly to get that out, and maybe some like damage to some of those valves in the leg that just were making it to where they just weren't performing the way that they should. So I went and had that done over Christmas break down in Denver and on Christmas Eve. So it was nice.
Merry Christmas.
Yeah, no, it was great. I got a nice little Valium nap and got done.
I mean,
came home and
sounds delightful to me.
Didn't Christmas because I was recovering, so it was kind of nice.
Yeah.
So yeah,
sounds great to me.
And that helped a lot too. It took me a few weeks to kind of really get back into things, and they encourage you to walk as much as possible. And I've been able to get in at least 10,000 steps a day most days, just trying to get everything moving, and I feel great. So, but
you've come a long way. And there was a huge difference between before your stent and your energy level. Like it was so different. There were moments where you were like, I can't get out of bed today.
Right. Yeah. And now, I mean, I I went from being like, I mean, truly like very, like I was at home most of the time. Like I didn't like to leave. I would leave to take my kids to school. I wouldn't go grocery shopping. My husband was managing most of the things in our lives that required leaving the house because I was so tired that I really like struggled with functioning. I mean, even socially, like it would be really hard. I'd have friends going to do stuff. I'd make plans to go do stuff. And it was just like, I feel like I'm mono. I am so tired. I feel like there's zero chance that I can leave the house right now. Like it would be dangerous to be driving. I'm so tired. And having blood flow to your brain, who knew?
Who knew
like,
that was going to be
better?
Yeah.
Right.
Well, and like not only that, but like just the overall feeling that you had after your stent was placed, you were completely different. Your brain fog was better.
Yeah.
You were able to just like function on a whole new level, but it still mimics endo symptoms.
Right.
So because so many of us have chronic fatigue, we have chronic brain fog. And so I think that that's what's so hard about differentiating between something like May-Thurner or some vascular issue and endometriosis. And I really think, and I don't know if I know anyone that has May-Thurner that doesn't also have EDS, which I do think there's a huge correlation there, and I don't know what that is, and I can't speak to that on a scientific level, but it just seems very prevalent for those who have EDS to also have May-Thurner, nutcracker, any kind of vascular issue. Because if you think of it, those are connective tissues.
Yep, they are. And I think, too, it's important to note that you can have May-Thurner anatomy where, like, that vein is compressed and you may not have symptoms from it. It's actually, I want to say it's somewhere like 28% of people have the anatomy for it, but they're not all symptomatic. So, and it's hard to find a lot of times. I mean, it was never seen on CT or any of the other things. It wasn't until I had MRIs done and venograms where they were like, and my compression was 81% compressed. So I only had 19% of the blood flow that should have been going through that vein, going through it. And, that's a pretty significant compression. Sometimes you'll see smaller numbers there, and with that you may be able to treat it a little bit more conservatively and wear compression socks and do other things and avoid surgery. But 80% compressed.
That's a lot.
It was a lot.
That was a lot.
And I do think there is a link probably between these vascular conditions and the connective tissue disorder stuff.
And again, that connective tissue disorder stuff and endometriosis tend to party together as well, along with POTS and, MCAS and all these other things. So it's like, this is a massive rager of a party of chronic illness.
Right. Yeah. And
chronic
they
diseases.
Do all seem to go hand in hand.
Yeah.
It's interesting you bring up the POTS stuff because growing up, I always had really, really bad orthostatic hypotension where like when I'd stand up, my blood pressure would just tank. Like, I mean, in the ground, just awful to the point where like every single time, I mean, I remember it from like being very young, standing up and the whole world goes black. And like, I just got to the point where I learned to like walk my first, 5 to 10 steps, like not being able to see anything, just like feeling my way around. And a few times where I fainted, I have a scar. I call it my Harry Potter scar on my forehead because I fainted and hit the banister once because I stood up too fast. And I had that for truly my entire life, like 30 years that I remember feeling that way. And getting my stent placed, it's maybe happened 5 or 6 times since then. Yeah. And there is a link, it seems, and I'm not sure that they know. There's a talk on YouTube where Dr. Spencer goes into more information about this and more on like a medical side of things, but she does talk about a link between POTS and these compression syndromes that people have, especially May-Thurner syndrome. And I think she's doing some studies on it right now to see kind of if we can kind of tease out what that correlation is or how those are connected. Because it was kind of a weird thing because I just wasn't expecting it. And then it's like, wait, I can stand up without fainting or almost fainting. Like I can just like leap out of my chair.
It's amazing what you notice when you like I noticed this even with my endo stuff. So like the other day I was talking to Elliot about it. So we were talking about bloody noses. And I was like, I haven't had a bloody nose since my surgery. Yeah. And I didn't realize, he goes, yeah, your bloody noses were cyclical.
Yeah.
And we just had to stop and think about it. We didn't put two and two together until just recently when we were talking about it. And I was like, oh my gosh, like this is why it's so important to continue learning even after you've had surgery.
Yeah.
Because I feel like there's so many things we learn about ourselves when we continue to understand the things that have affected and really like invited themselves into our bodies in a way that is a lifelong thing.
Right.
We always have to be aware of these things, whether we're really impacted by them at that time or not. Being aware of them and some of the symptoms that go along with it, I think changes the outcome of our care for everything.
Yeah, it does. And I think too, we get so used to just not feeling great that like it's our baseline. So then when like there were things, like the dizziness, the fainting, that type of stuff, like I didn't even realize how big of a problem it was because it was just like part of my life, and then once it stopped happening, it was like, whoa, like this is really weird, or, with my like leg vein ablation that I had, they bothered me a little bit, but it wasn't, I mean, I'm so used to just like severe chronic pain. And I spent so many of my years dealing with that severe pain. It's like, even these like little small changes that I have, like it was actually pretty significant how much better I felt. And it was, I don't even think I realized how much some of these things were affecting me until they were gone. And I was like, wow, like I actually feel way better. I actually feel like maybe I'm getting pretty close to what a normal human feels like even sitting in a chair like this.
You couldn't have sat.
Oh, no, like Alana's been on a plane with me more than once. And it's like, I am like a 3-year-old in my chair. Like I cannot sit because I would just get this like burning pain deep in my hips and kind of my buttocks joints there and all that. And it just hurts so bad to sit. And I can sit all day now. I don't like to because I like being up and moving. I don't sit well. The ADHD doesn't allow it. But I can sit on an airplane without like driving everybody around me crazy because I'm squirming in my seat like a 3-year-old.
Well, and it would like put you out for a while.
Yeah.
So like you would go on an airplane, we would get somewhere, and then you would be kind of done pretty much after that. Like it was like traveling took so much out of you just to get to where you needed to go that you had to plan accordingly so that you could have time to rest, that you can get your legs up, you could whatever. And so now I feel like you're able to, I mean, we have where we got off the plane and we just go.
Right.
And
riding a luggage cart.
Riding the luggage cart. Oh my! We had they been in that hotel hall when we were riding the luggage cart, I'm pretty sure we would have been kicked out.
Yeah. Oh yeah. No, it's a miracle that
there was no tequila involved in that. That was just pure insanity on our part.
Yeah, we hadn't even really started being wild at that point, and it just I mean, I would have to buffer in a day from like traveling where it's like I get to where I am, and the rest of that day is done.
Yep.
Plan anything like room service, maybe like order DoorDash to the hotel. And then the next day I could do stuff. And then coming home, the same thing. Like I would always block out the day after a trip because I needed an entire day to just like rest and like let my body heal and let everything get back to where it's supposed to be. And I, sitting and being tense and having that pain and like my muscles hurt and I'd have to book massages and
which are counterproductive when you have EDS.
Right.
Like it's
I finally stopped doing
helpful.
that and I do feel like it's helped a little bit. But yeah, like, I go to pelvic floor PT. I traveled with my pelvic floor PT more than once. So sometimes we just bring her along.
Because we need help.
Yeah. And she's super fun.
Oh my gosh.
She's
so
the
much
greatest
fun.
human ever. She's part of the debauchery too. So
100%.
She's the loudest out of all of us, believe it or not.
Yes, she is.
But she's so fun.
So fun.
Yeah, I highly recommend traveling with your pelvic floor therapist.
Yeah.
If you can do that. Especially if they're really fun.
I think that's what and we say this every single episode, and I am a broken record, but like community matters because had you not said something and had you not gone down this path, so many people that we know would not have had that diagnosis because they were able to convey their symptoms and you were able to, help them consider that this could be a possibility. And that's something that like you can't just like go online and look half the time because there's so many symptoms that are the same.
Right. Yeah. Yeah. And it's really hard. Now, one thing, if you are trying to kind of differentiate pain from vascular stuff to endo pain. And
Mhm.
it's not a 100% thing. But a lot of times, if you have pain and you decide you go rest and you get off your feet, and especially if you can get your legs up a little bit,
Yeah.
prop your legs up and get some of that blood. And if you feel better, that's actually a pretty good sign that what you're dealing with is probably vascular.
Right.
And so, you can use that as you wish. I'm not saying it's a diagnostic tool or anything along
Right.
those lines, but it might help for those that are seeking treatment, where it's like,
Right.
hey, I feel really bad. I had endosurgery. I noticed that I feel better once I lay down and I'm off my feet, or I notice I feel better when I wear my compression socks,
Right.
and I highly recommend, like, vascular issues or not, wear compression socks. They are
Yeah.
they help so much, whether you have the issues or you don't. They
Yep.
really do make a big difference in just
Huge.
how your legs feel. So I have like the really sexy ones that come like all the way
The
up to my
grandma
rib cage.
ones.
And I put them on with garden gloves. My husband I'm just like, you are so lucky to be married to
His
this
trophy
hot piece
wife
right
at
here.
her finest.
Right, putting her giant grandma socks on, but they help,
Yeah.
and
Yeah.
I don't feel like I have to wear them like on long days or anything. But if I know I'm gonna have like a day where I'm gonna be
Right.
standing all day and on my feet for 12, 16 hours,
Or
like,
in an airplane.
or yeah, like,
Yeah.
and they're especially on an airplane, because they're gonna
Yeah.
help you not end up with blood clots, hopefully. And those can happen to anybody on an airplane.
Yeah.
You don't have to have weird, crunchy, weird veins to
Yeah.
have that happen. So yeah, highly recommend good compression socks. You can find them on Amazon. You can get them. Bombas makes good ones that I really like. I like theirs
You
a
can get
lot.
compression leggings too.
Yeah. Yeah.
High compression. I know there's some out there and they're like, I don't know, they're a couple $100, but they're like really tight.
The formy ones.
Yeah. I have not tried them. I can't stand by them and I can't tell you whether to get them or not, but they are out there if you need something really high compression.
Yeah. Yeah. And they make different gradients, for
Right.
it. Like you can get like lower compression ones. And, on days where I'm not doing a lot, I'll wear my lower ones. But on days where like I'm traveling or something, I put on the big boys. And
Cleaning the house.
They're attractive, but you know what? I feel better and I'm a nicer
Yeah.
person when I wear them. So,
And you can do what you need to do longer. Like it gives
Right.
you the energy to do it because you don't have the pooling and you don't have, like
Yeah.
it preserves some of that energy.
yeah, it does.
Mm.
And yeah, like I said, it's not a huge issue for me, which is great. Like I don't have to wear them, but it definitely makes things just a little bit happier. So,
Well, that's true with like even EDS.
yeah.
Like I think maybe that's why we do so well with compression is because we have these bendy bodies that just do not like to hold themselves up. So that helps
Yeah.
with
Yeah,
like the
it's
fatigue
like,
and
I like
stuff.
to be squeezed
But
into place.
yeah, me
Keep
too.
everything where it's supposed to be,
Yeah.
please, because it's too easy for things to not be where they're supposed to be.
And I don't know if I have May-Thurner. I haven't looked into the vascular stuff as much. I don't follow a lot of that guideline, but you don't have to, like, to still be impacted by it. I think that's something like I will probably venture down that path. I'm one thing at a time, right? Like we
Right.
all do this one thing at a time. And that's one thing I want to encourage people to do is like, even if you're considering any sort of vascular issue, do one thing at a time. Don't try to tackle everything at once because the minute you do that, it gets so overwhelming and it gets a little muddy. Like you can't really differentiate between what's helping and what's not. And I don't know. That's something that I've learned in this process of like figuring out little things that are little or big things that are going on with me is it's one step at a time.
Yeah.
Don't try to do everything at once if
Right.
you're in this process.
Yeah, I agree with you. I think it's a really good idea for
Yeah.
people that go through these and, take it that one step at a time, really investigate one thing thoroughly, get treated for it, give your body time to heal.
Yeah.
We get in this like, oh, you had excision, you'll be back to normal in 2 weeks. You can
No.
go back to work. You can do it's like, no, like,
Mm-mm.
do not do that. Do what you feel comfortable doing. But it is, a year-long process for your body to heal from, especially these like extensive excisions where they're removing the peritoneum and they're taking out ligaments. And
Yep.
I mean, it's a lot on your body and it takes a long time for your body to truly heal from that. So I think it is good to take things slow, take
Yep.
them one at a time, address them, individually,
Mhm.
and then see what happens. And if that doesn't work, move on to the next thing after some time.
And find yourself a support system.
And find yourself a support system. Yeah, I'm so lucky that our pelvic floor therapist brought us all together. And
Yeah.
it is like, I can't even tell you how lucky we all are to have each other. Like, Alana is just one of my favorite humans.
Same.
We've talked about, and I'm sure you guys are tired of hearing about it, but we
So
have
tired.
so much fun. Like,
Yeah.
my face hurts after hanging
So
out with
much
her. I don't know that I'm going to make it to the summit this year. And I'm just like,
Already grieving.
destroyed over
I'm
it.
already
I'm trying
grieving.
to figure out if I can fly out at like 9 o'clock on a Friday and fly back at like 7 o'clock on Sunday night, because I'm like, I can't imagine not going and not having those days of just like hilarious, crazy. It's so much fun. We have the best time.
Yeah, our Snapchats are private for
Popular.
a reason. Yeah. It's so, and here's the thing is like, I think because we get each other, we get where we're coming from, we can joke around about these illnesses in a way that is like so relatable.
Right.
And then I think the other part of this too is like, for us, we're very similar. So that's probably part of it. But like the whole group, everyone on the board, we just get along. Like it's not a normal nonprofit where, you know, you might like some people, but maybe you don't like the other. Like that treasurer doesn't let you spend any money. No, it's not like that at all. It's like such a tight-knit group,
right?
That when you allow yourself the space to do this and like be involved with people, your life is so much richer.
Right. Yeah, it really is. I mean, it's amazing. And it's so good because, you know, on the good days we support each other. On the bad days we support each other. There's times where, you know, in our Instagram messages to each other, it's just all like hilarious chronic illness.
Funny.
There's a lot of poop talk in our Instagram messages.
A lot.
Which is hilarious. You probably wouldn't expect that from Alana and I. But yeah, like everything. And we laugh about everything. Because if we weren't laughing, we'd be crying. And we don't want to do that. We want to find joy in what we can. And we want to find that sense of connection with each other. And sometimes a poop joke is what brings us together.
Yep. We are part of the Angry Pelvis Club.
We are part of the Angry Pelvis Club. So, but mine is so much less angry.
Yeah.
Like I feel like I might have to turn in my membership card at some point because it's just it's a lot less grouchy than
grandfathered
it was.
in.
Yeah. Yeah, I'm an original founder. So
you are. I'm pretty sure you're the one that came up with that. So
I am. My husband was just mortified.
No, both our husbands for some reason don't like it, which I think is really weird.
Yeah, Jackson, my teenage son, thinks it's hilarious.
But that's why he's one of my favorite kids in the whole world.
So he's definitely the favorite. Of the other three that we have, but he's funny.
He's so funny. And he's going to be like the one child of yours. He's the only boy, mind you.
Yeah.
He's going to be the one that is like going to be the loudest advocate for any woman in his life.
Absolutely. Yeah, he is not afraid. Like he went to summer camp this summer and explained to his entire cabin what maxi pads were because none of them knew. And that's my kid. And he was like, you guys should know this. So yeah. I was like, good job. And he's 15 and just,
he's the best.
He is the best.
He's so awesome.
All my kids are great.
They are.
He's the one that's like very pro like endo. Which is funny because the other three are girls and you would think that they would be like, no. But no, he's the one that's always like asking about people's uteruses and stuff.
Always. He'll scream uterus from anywhere in the house.
Will. Yeah. So have fun talking about uteruses.
Yeah, all the time. He's the best.
He leaves. We know endometriosis is not a uterine disease.
We know
He knows that too, but he just thinks the word uterus is funny. So
yeah, we do talk about it a lot.
Yeah.
So I mean, he's the best.
He is the best.
Yeah. If you could tell people that are in this journey 3 things of advice, like what would it be in trying to process this so that gives them a good guidance as to like steps to take?
So just a lot like it is with endometriosis, finding the right specialist is so key to this. Especially when you're talking about getting things like stents, or they can go in and they can place like coils or like foam blocks in some of these like collateral veins that grow to kind of work their way around that traffic jam that you have. having the, like, a lot of that stuff is permanently placed. So I think it's really important that the doctor that you're seeing has a good reputation, that they have a history of good outcomes, that they can discuss those with you, that they're involved and they're paying attention to what the new research is saying, that they're doing
Right.
continuing education. And so, like, with my first stent that was placed, we think that it probably wasn't the right size. And that's why it just was
Mm.
not doing what it was supposed to do. So making sure that you have a stent that's placed, that's the right size. And so it's really that expertise.
Yeah.
And a lot of these doctors, it's kind of like the endometriosis world where they are like gaslit by their peers, where it's like, what are you doing? Why are you treating this way? Why are you thinking this way? And they're kind of the outliers that are treating these diseases. And it's not like it's they're doing really, really good work for
Mm-hmm.
patients, and patients are having really good outcomes a lot of times because of this. Not everybody has a perfect outcome. And I think that's always important to make sure that people know you can have complications. You can have, may not feel better. You may feel
Right.
worse, but I feel like overall, statistically, it does seem to make a really big difference. So yeah, that level of expertise is very important, just like picking a good endometriosis surgeon. You don't want to go to just anybody. And there are some places, throughout the US that treat this. If you want to see somebody here in Denver, I do really love Dr. Spencer's office. But if you are looking for somebody, like, she might be able to point you in the direction of someone that's closer to your home. And there's a
Right.
lot of people that travel to Denver like pretty regularly. She sees people from all over the world that come in and have these treatments with her office. And the other docs in her office are great too. So
Yeah.
I like them, and I've done a few things with them over the years, and they've been very, very helpful, and they're very knowledgeable. So that's one thing. Sorry. I do think you really have to keep fighting.
Yeah.
It's a lot like endometriosis, where you really do get gaslit again. I remember talking to my PCP about it and talking to her about my symptoms and stuff. And I was like, well, I kind of think the endo could be back. And she's like, well, that's not possible because you had hysterectomy. And I was just so irritated. I never went back. I found
No.
a new doctor who I love, who is so, so knowledgeable and does a great job and really like trusts me. But, and this kind of goes also with like finding good PCPs and finding good
Yeah.
doctors that will help you find the right path for whatever your pelvic pain generators are, that are interested in helping you explore getting better, that aren't going to sit there and tell you that you just have to suffer. Because I really did think for a long time that this was just going to be my life, and I was just
Mm-hmm.
going to have this like chronic, dull, you know, gnawing pelvic pain for the rest of my life. And that doesn't have to be the case necessarily. I do think that I had very good outcomes, and I think that there's a chance that other people may not have as good of an experience. And maybe I got a little lucky, but I don't usually get lucky when it comes to medical stuff. I'm usually the one that has the complications and gets hospitalized and has multiple surgeries to fix things and a lot of drama. So I just think that advocating for yourself and finding the right team to help you navigate
Yep.
whatever it is, whether it's hernias, it's pelvic disease, venous disease, whether it's endometriosis, fibroids, whatever happens to be causing your issues, just find the right team to help walk you through it and find like the strength to really keep fighting, because you're going to get
Yeah.
told no a lot. You're going to get told that you're crazy. You're going to get told that can't be, that's not how this works. It doesn't go that way. Veins don't work like that. Well, mine did. So, and I feel great now, and I'm able to pursue the life that I want. And, just that there's hope on the other side of
Yeah.
this. I spent a lot of years very depressed. Really, I mean, just like teetering on the edge of just losing my absolute mind, because I was so ill and I had no support. I had, great family support and
Right.
support through friends and stuff. But when it came to the medical system, I had nobody, no one. And I was really, really hopeless. And there was a lot of times where it was just very, very hard for me to get out of bed and just keep going every day and deal with what I was dealing with. And I really did feel like I was crazy. And being on the other side of it and literally living my dream right now, like, if you would have told me 5 or 6 years ago that I would be in school, like in a fast-paced program full time, that I would be enjoying it, that I would love going to lecture and sitting there for 4 or 5, 6 hours.
Still
and like,
weird to me.
I know, but it's so fun.
So weird.
It's so interesting. We talk about cool stuff.
I know.
But and that I would be able to go and stand. Like last week, I worked in the GI suite, And I stood in there for like 9 hours straight, like in one spot. I mean, I had to like shift a little bit, and I got to walk down up and down the hall with patients a few times, but it was so amazing that I'm able to live the life that I want to live. And it's something that has been so out of reach for me my entire adult life. Like, I've wanted to pursue nursing since I was young. And it was just like, I could never do that. Like, I don't have the physical capabilities. I don't have the stamina, and I am not well enough to get through an intense program like that. Now I'm doing it.
Now you're doing it.
And I have great friends. I have a great family. I have a great husband. And it's just things, years ago, I just really never thought I would be here and be in the place that I am in. And I am here now. And it took a lot of fight, and it took not losing hope to get there. And it took a group of girls behind me too that listened to me cry a lot. But
and you're listening to me cry that you're in nursing school because I lost my day friend.
Your day friend. Sometimes Alana and I like to go to lunch and have a glass of champagne.
Yeah.
But now I don't.
Now you don't.
I don't leave the house except to go to school.
And it really bothers me. I'm just telling you right now.
No, I don't like it either.
I feel like I miss you too much.
I don't see anybody anymore. Even my husband. I come home and I like go sit in the office, and I'm just there until like 11 o'clock at night, and he just like walks by and like, wait, I'm like, sorry. I got to get through this, and I can't do it. Well, you're watching TV, so.
Sorry. Yeah, well, I am thankful that we get to just at least spend time together today.
Yeah.
And I'm thankful that you did this, because this has been like a really long time coming where we've talked about it forever, because there are so many times that we've had this conversation and we're like, we wish that we could record this for someone who is struggling. And I cannot tell you how many people I have come across who have messaged me or whatever. And I'm like, and they talk about May-Thurner, they talk about some sort of vascular issue. And I'm like, here's the person to talk to, because she understands it in a way that I don't understand it. But I think that we need to have some more recognition behind it, because I really think that this needs to be in consideration with an endometriosis diagnosis. Like, I don't think that they need to be looked at necessarily separately. I think when we're talking about doctors looking at the whole picture, we have to start talking about this as well as an endometriosis diagnosis. Like, and there's ways of non-invasively finding out whether you have this or not. You don't have to have a surgery to find if you have any vascular compression issues.
Right.
Like, you can tell on imaging. That is something that you can do.
Yep.
And I recognize not everyone has that accessible to them. Like, that is a privilege. So I do understand that from that standpoint. But I really think that this is going to be the future conversation.
Right. Well, and I'm really happy because I know that, we have a handful of endometriosis specialists here in Colorado. And I know that they all refer as soon as a patient comes back post-excision, or sometimes they'll even send them to MIPS first to get evaluated and then make a plan from there on if they think that it's, especially if they're like, oh, I'm not sure this is endo, like maybe go get this looked at. And I think they're consulting with her too. And like, hey, should we go this way? Should we go that way? And I had a surgeon that I was working with out of the Pacific Northwest who consulted with the interventional radiologist and went through stuff, and they both looked at my scans, and and it's like that type of collaboration is going to make a huge difference in patients' lives. And the more that we can talk about it, the more that we can bring awareness, not only to endometriosis, but to all this other stuff that happens to go hand in hand with it, the better impact that that's going to have long-term on our patients.
Yeah.
So,
well, and I know like even Dr. Zach Spiritos refers to Dr. Spencer, because there's so much of a correlation there with like GI issues and nausea and all this other stuff. So I think like we're going to start seeing some of that collaboration happening even more, because there's not a one size fits all doctor.
Right. Yeah.
Like they have to, multidisciplinary, but is always a term we'll use, but they can't work in silos if you're going to have better outcome.
Right. Yeah. And when we talk about that multidisciplinary care, you need a good endosurgeon, you need a good pelvic floor PT, you need somebody that can help you with the nutrition side, and you might need a vascular specialist, whether that's a vascular surgeon or an interventional radiologist, someone who knows these things, because it's very, I think it's, very anecdotal, but just how much we've seen of it in our small group. It's hard for me to imagine that we are the outliers, that it's just a coincidence that like half of our group has May-Thurner that we know of. Like that just does not seem statistically possible for that to be a coincidence.
And
So
yet somehow we're still here, like talking about this.
Right. So fight for the care that you need, and research it, look into it, understand what these things mean. Because there are different ways to treat it. There's different theories to how compression should be treated. Some believe it should be treated from the top down. I was really lucky because with my stent placed, I pretty much fixed my nutcracker syndrome. Like it's like I don't have any symptoms of it anymore. I don't. My last scan, my renal vein is finally like happy and free and living its best life. Whereas before it was like scrunched and unhappy. It made a big difference, but some people, have to treat it a different way, and they do it a little bit differently, and they treat from top down. And so find the right specialist that's going to help you navigate what's best for your situation.
Yeah, absolutely. Okay, you have to come back again at some point.
Well, you can have me, anytime. In the summer. I'll come hang out with you all the time.
I know, because I just feel like it's so much more, I just love spending time with you.
I know. I love spending time. Even when we're working, we still have fun. Like we do work days where we'll get, we haven't lately because
nursing school. I'm not bitter about it at all.
Someday you'll be happy. I'll be done soon. I only have a year left. So we're getting closer. But we do our work days. We have so much fun. We just hang out. We drink our just peaches.
It is an addiction. It's the bad addiction.
How is it that mine's almost gone?
Because I don't know. I just am a slow drinker sometimes. Yeah. Well, anyway, thanks for coming.
Thanks for having me.
I always love having you. And if you want Chelsea to come back, which I think you might, leave it in the comments. Let us know.
And if you don't leave that in the comments because that'll hurt my feelings.
And also let us know your drink order. And maybe I will try that next because I do think, I like to try new things sometimes, and maybe I'll find a new addiction. So you never know. But until next time, everyone, continue advocating for you and for others.